So this is the exciting part, and this is really the graph that most people are interested in. So we treated 10 patients. And again, because and I saw a question flash up, how will we modify the study? This we didn't expect that by 15 days we will have cleared most of the tumors. We thought by 15 days we would have a robust immune process that would be essentially taking down tumors. But by day 15, 6 out of 10 patients had complete clearance. Now, the way this works is this: the clinician, Dr. Avendano, looks at all of these patients, looks at the lesions. Some patients had up to 4 lesions. Because this is a human trial, the humanity requires we can sample some lesions, but we can only sample one per patient. It's not like a lab animal. So a representative lesion that looks, Dr. Avendano would say, this looks like it's responding, or it's not, or I'm not sure. It's representative of everything that's going on. You do a biopsy. So the biopsy is representative of the patient's process. And 6 out of 10 times that biopsy confirmed that there was no tumor. And I'll show you some pictures that make it's difficult in melanoma and in some other cancers to know what the residual change is, whether it's ongoing disease or whether it's completely responded. We can generally tell when a disease is progressing or not responding, but partial responses and complete responses in immunotherapy are not always obvious. And so the biopsy is necessary to confirm the clinical response. In 2 patients, the patient number 8 and number 10, we saw at day 15 in one of the patients a 90% response rate, and that was fantastic. So, but that we did have provision to do a further biopsy at day 28, and in day 28 we saw that the tumor was starting to regrow up to 50% residual. This is important information. We'd be astounded, not very difficult to defend how 100% of people could have responded so completely. So that's important information because this is the nature of biology, and so not everything is 100% all the time. The other patient, patient 10, had a 50% response at halfway at day 15, and then it continued to respond down to 20% by day 28. So this is evidence, this is good clinical support of an active biological process that's evolving over time. The other 6 patients, and 2 patients, patients 3 and 4 did not respond. And sadly, 2 patients, these patients had advanced diseases and they were progressing well beyond anything we could offer them. And in fact, those patients died after completion of the trial, but full disclosure, they passed from progression of their disease elsewhere. So, and again, this is within the spectrum and nature of cancer treatment, but 6 patients, not only did they respond, but they responded by the biopsy at day 15. These biopsies showed only residual immunity, cells that were no evidence of cancer cells, and the cells in the biopsy are, we would call melanin-laden macrophage, cells of the immune system that are essentially cleaning up the aftermath of the immune process.